You're happy to have your booster dose today?
Yes.
Which arm would you like it in?
This arm.
Okay, do you want to roll up your sleeve for me?
Just 9 months after the first COVID-19 vaccine was administered amidst much fanfare, today came the first booster shots. Both in England and Wales, health and social care workers along with care home residents were at the top of the queue.
I've not managed to catch COVID all this time. Even if I work in a hospital environment, I'm out meeting the general public. I've been exposed sometimes to the COVID disease. So having a booster is the extra protection that I need. And again, going into winter as well, that I feel confident, going into winter.
Millions will be offered the jabs, with the programme being rolled out in the same order as last time. Those 50 and over, anyone over 16 who's clinically vulnerable, or is a carer or lives in a house with a person who is immunosuppressed. The only requirement that it is at least 6 months after their second dose.
When the NHS contacts you, please come forward and have your vaccine. It might be a text message, it might be a letter, it might be a phone call from your local GP practice. But when you get asked, do come forward, because it's the best protection as you go into winter.
This may be the advice from the experts here, but it is against the wishes of the World Health Organization, which recently called for a moratorium on COVID booster shots. Africa alone is facing a 470 million vaccine shortfall this year. Just 17% of the population are likely to have been vaccinated by December. The UK government points to its pledge to donate 80 million doses abroad, but the reality is they can see a tough winter ahead for the NHS, and their priority is averting that disaster. Getting booster shots into the arms of those where the immunity is waning is part of that plan. A raft of figures today show the impact the vaccines are having. According to Public Health England data, infection rates fell last week in every region of England and in every age group except 5 to 9-year-olds, perhaps following their return to school. And also from PHE and Cambridge University, an estimate that vaccinations have directly averted about 230,800 hospital admissions in England.